The 26 billion opioid crisis deal that pharma firms have struck in the US. If the deal gets formal approval, lawsuits will be dropped against three drug distributors: McKesson Corp, Cardinal Health, and Amiso, AmerisourceBergen Corp, and the manufacturer Johnson and Johnson. Three of America's biggest drug distributor and one manufacturer on Wednesday agreed with a group of state attorney general to reach a settlement worth 26 billion for their alleged role in fueling the country's deadly opioid epidemic, which has killed lakhs of people over the decades. If the deal gets formal approval from states and thousands of local municipalities, lawsuits will be dropped against the three drug distributors: McKinsey Corp, Cardinal Health Inc., and AmerisourceBergen Corp, who will pay around 21 billion combined, and the manufacturer Johnson and Johnson 5 billion. The framework under this settlement will allow billions of dollars to start flowing directly into communities to bear the steep costs of addiction treatment, family support, education, and other social programs. America's opioid crisis. The US is currently going through an opioid overdose epidemic, with over 130 people dying each day from opioid related drug overdoses. The misuse and addiction of opioids includes prescription pain relievers, heroin, and synthetic opioids such as fentanyl has caused a national health crisis that has affected public health as well as social and economic welfare, according to the National Institute on Drug Use. Since 2000, prescription opioids, heroin, and fentanyl have been linked to death of over 5 lakh Americans. In 2017, an estimated 1.7 million people suffered from substance use disorders related to prescription opioid pain relievers, and 6,52,000 suffered from heroin use disorder, not mutually exclusive, according to NIDU. That year, former President Donald Trump declared the opioid crisis a national emergency. In 2020, overdose deaths from the crisis crossed 93,000, a record high that was partly driven by isolation and discontinuation of services during the COVID pandemic. As per the Center for Disease Control and Prevention, the misuse of prescription opioids alone is estimated to cost US 78.5 billion each year, including the cost of healthcare, lost productivity, addiction treatment, and criminal justice involvement. The crisis began in the late 1990s when pharmaceutical companies in the country aggressively marketed prescription opioid painkillers while reassuring doctors that their patients would not get addicted to them. As rates of prescription soared, so did the diversion and misuse of drugs, making it clear that they were highly addictive. What are the 26 billion settlement doses? The three distributors who are part of the deal were accused of ignoring for 2 decades the limits on prescription drug shipments as pharmacies across the US kept ordering the medicines in massive quantities. The manufacturer Johnson and Johnson is blamed for downplaying the addictive effects of their products to doctors and patients. The three distributors said in a joint statement, while the company strongly dispute the allegations made in these lawsuits, they believe the proposed settlement agreement and settlement process it establishes are important steps towards achieving broad resolution of government opioid claims and delivering meaningful relief to communities across the United States. The Wednesday deal worth 26 billion will now go to states and their municipalities, which have 30 days to deliberate the offers and decide how much money each would receive under the settlement. For the agreement to be finalized, a high majority of states would have to be in favor. As per a New York Times report, over 2 billion of the 26 billion deal would end up going to cover the legal costs of the opioid litigation. Once finalized, the pharma companies will be able to walk away from the lawsuits. Over the next 18 years, the money will go to governments to cover the cost of prevention, treatment, medicines, education, and other opioid related problems and will not be used to compensate families of victims of the epidemic. According to the NYT reports, apart from the 26 billion settlement with four giants, there are many negotiations still underway between other pharma players and governments. Put together, the total value of opioid crisis related settlements is expected to touch almost 33 billion. Thank you.